Thank you for joining us. This is a HACC Nursing Program Information Session. My name is Cindy Donnell, and I serve the students at HACC's York campus as their Campus Director of Nursing Programs. So today we'll share some information about both our practical nursing program and our associate degree nursing program. Before we get started on the presentation, I thought it would be helpful if we can take you to the website and help you to see where you can find information related to the program. So what we have here is the hacc.edu website. So it's www.hacc.edu. And when that website comes up, this is the page that you'll get. Over here, you'll see a search engine. If you click on that and you're looking for information about our RN program, if you put in RN, the search engine will bring up a page. That page is the Nurse RN page. When you click on that, it'll take you to all the information that we're going to be discussing today and links to take you to items that may further answer your question. The most important thing, and the first thing that I want to point out, is this link that says admission criteria and essential qualifications. When you click on that, what will pop up will be really the central information page for you. Talks about selection to the nursing program. It discusses our T's, testing. Here in red are the links that you would use to apply to the program. This is the RN link. This is the LPN link. Now, if you click on them now, it will not open because, as you can see here, this is a list of application cycle dates. It will tell you what the campuses are that are offering a program for that admission cycle, how many students they accept in each of those admission cycles, when that application window opens, when you would have to have your TEAS test completed to qualify for consideration in that application cycle, and then when the applications close. It also gives you an estimate as to when the students will be notified. And then this is an intent due. So when we accept you into the program, you will need to send back an email saying that you have accepted us. So we have given you a vacancy and you are accepting that vacancy. And then this will also give you an idea of when your background checks must be complete. The background checks we'll talk about in a very short time, but we will help you to understand that those background checks need to be done before the first day of class so that we can make sure that we don't enter you into the program with a background check that might disqualify you from being in the program. And so that is listed on the bottom row here. Also talks a little bit about immunizations and the physical exams. Here is about the background checks. We're going to get into that all today, but I just wanted to make you aware of where you can find it should you have questions that come up after we're done with this information session. Additionally, on here, a question that we get asked is, I want to get ready for the TEAS. How do I do that? Again, going to that RN page, here is the TEAS information. And if you have questions following this information session and you really feel a need to talk with someone, it will be important to know that you can always connect with our advising team. And here's how you do that. Clicking on this link will take you to an email ability to connect with our advising team and either be assigned to an advisor, find out who your advisor is, or get linked to an advisor that might be more informed about the nursing program. If you're looking for information on the practical nursing program, it's the same thing. You go to the website, click on this, put in the word practical. And when you search it, the practical nursing page will come up and offer you the same kind of information. This page looks a little different, but you click on the view program requirements and it takes you to a page that looks very similar to what we found when we clicked on the RN page. So having said that, that is the resource for the information that I'm giving today. Now what we're going to do is start the program. So we are one college at HACC. And what that means is that the nursing program is offered on the Gettysburg campus, the Harrisburg campus, the Lancaster campus, and the York campus. But it is the same program. The courses are exactly the same curriculum, whether you are on one campus or another campus, as well as if you're in the evening program or the day program, the course is exactly the same. What differs is the pace of instruction, and we'll talk about that in just a few minutes. What is very important for incoming students to understand is that while before you were in a clinical program, you could select a biology course from the Harrisburg campus and an English course from the Lancaster campus because you didn't mind going to two campuses and that schedule met your personal needs. You cannot do that in the nursing program. When you get accepted into the nursing program, you'll be accepted into a specific campus's program and a specific program on that campus. So for example, if you are in the 4-semester day program at Harrisburg, you must register for courses in a sequence that is set and inflexible for that cohort. If you would need to move to another program or to another campus, you do have that ability to do that at the end of a semester by requesting transfer. You would do that by connecting with your campus director, letting them know that you intended to do that, and they would assist you in filling out a request for transfer to be sent to the campus that you wish to transfer to. Transfer is not guaranteed. We are restricted to a certain number of vacancies within our cohorts because we need to be able to assure that we have clinical space for everyone in the course. And so while we try to accept all of the transfer requests that we get, it is not guaranteed. It is based on vacancy. So again, we are one college, one nursing program. Our dean is Dr. Dory Allman, and she serves as the dean for not only nursing, but the other health careers within the HACC system. She is assisted by our Associate Dean, Megan Brightbill, and the Department of Nursing chair is Monica Filburn, and she has a partner as the health career chairs for all the other health careers within the college. So what is a nurse? The best analogy that I can give you for nursing is that we are a team. As a nurse, you're going to be taking care of patients who are at very vulnerable times in their life, and you are the person who is helping them to become well again. And that involves working with not only the patient, but working with their family members and other people who support them, as well as serving your community and making sure that you are providing support for a healthy community. And that's what you'll learn here at HACC. But a nurse comes with various types of nursing. So here at HACC, we educate nursing students who want to become registered nurses, and we educate students who want to become practical nurses. And then in our non-credit workforce, we educate students who want to become certified nurse aides. The registered nurse is considered the coach of the football team. And we'll talk about how that differs from the LPN in a few minutes. But even within that registered nurse, there are multiple educational paths that a student can take to become a registered nurse. They may choose the Reading Hospital School of Health Sciences, which is a diploma program, and become a diploma graduate. They may choose to come to HACC, which is an associate degree program, and become an ADN. or they may choose to go to a bachelor's program like York College of Pennsylvania and become a BSN. All three of those educational tracks graduate students who are not registered nurses until they sit for something called an NCLEX exam. It is a national licensure exam. And once you have passed that exam, then the state of Pennsylvania will issue you a license and you will become a registered nurse. The diploma grad, the associate degree grad, and the bachelor's degree grad will all take the same NCLEX exam. There is no difference in that. From a practical nursing standpoint, there is only one entry level. Practical nurses in the state of Pennsylvania get a certificate. That is what our program here at HACC offers. But a practical nurse is a student who graduates as a PN, sits for the national licensure exam called the NCLEX PN. And once they have passed that licensure exam, then they become an LPN. So that's what we teach here at HACC. It is a stacked program. You can become a CNA here at HACC, go on for your practical nursing certificate, and go on for your associate degree. Right now, from this very, very first informational session, we want you to understand that it is our philosophy at HACC that we are a starting point. We intend and expect that our graduates will continue their education beyond HACC and become an advanced degree BSN student, MSN student, and progress through their professional progression. So an advanced degree can allow you to become a nurse practitioner, a nurse anesthetist, a nurse educator, or an administrator of nursing in a facility. So what's the difference? Well, if you remember, I talked about the football team. Nursing is a team, and each member of that team is extremely important to the quality of care that we offer to our patients. Just like a football team, if we didn't have an equipment manager, we didn't have a player, and we didn't have a coach, that team wouldn't be as successful as if all three of those partners in practice work together. So the CNAs, our certified nurse assistants, are the equipment managers of the team. They're very important for keeping things organized on the unit, interacting with patients and helping them with their diet, interacting with patients and helping them to ambulate, to do their self-care. They interact, they communicate, and they provide comfort to the patient. The practical nurse is the player of the team. They must do everything the CNA does, but they have an added responsibility for coordinating the care for a team of patients. They're going to be taking care of patients who are fairly stable patients with less complex health issues. They're going to be talking to the patient, observing the patient, collecting data about how that patient is doing, sharing that data with their RN to help inform the plan of care. The registered nurse is the coach of the team. The registered nurse must be able to do everything that the practical nurse can do, as well as the CNA. But they have additional responsibilities for being the manager of the care for the patient. They take the data and observations that are brought to them by their LPN partner, and they decide what the forecast is for that patient, what complications may be on the horizon that they need to think about preventing, communicating with the physician, things that are unstable or things that have changed, assessing the patient and coming up with a plan of care. They also are the nurse who would be assigned to the more unstable patient, somebody who may crash, quote unquote, in the middle of the shift. So this is the difference. It's really important that all nurses understand that they have a really important and valuable role within the team, but we each have to make sure that we can respect the responsibilities of all of our nurse partners. All of these nursing professions, practical nursing and registered nursing, are STEM professions. That means that to be successful, the student needs to understand science, especially biology, technology, the ability to work with machines. There's a lot of electronics within healthcare at this point, and having an understanding of technology is important. Engineering, how to problem solve, math. So excellent reading skills, a good biology science skill, proficiency in math, basic computer skills because the electronic medical record that will be a part of practice, strong critical thinking skills, and the ability to communicate. You'll see that when you take a look at these key important skills, the TEAS test, which is what we use as a determination of application, measures many of these. What campuses offer nursing? Our associate degree, which is the ASN, which allows the graduate to sit for the NCLEX RN exam, is offered at the Gettysburg, Harrisburg, Lancaster, and York campus. The practical nursing PN program, which allows the graduate to sit for the NCLEX PN, is offered on Harrisburg, Lancaster, and York campuses only, and the schedule is consistent. Every campus has the same practical nursing schedule. We did mention that we are one college. It's important that you understand that when you are selecting one of our campuses, it's not just transportation to the campus that you have to consider. In order to give our students the clinical experience that they need to be a successful nursing student, we partner with hospitals and facilities in our area. You need to be aware of which clinical facilities that campus utilizes and assure that you understand how you're going to get transportation from your home to not only the campus, but to the clinical facilities associated with that campus so that you are on time for each clinical experience. How long does it take to complete the program? Well, it depends on which program you pick. The practical nursing program is one selection. It is a 4-semester program. It is primarily in daytime hours, and it is offered consistently at all 3 campuses with the same schedule. The associate degree program is offered in a 4-semester curriculum. That 4-semester curriculum involves fall and spring semesters, but no summer obligation. The 4-semester curriculum is designed so that the college's 14-week semester is broken down into 2 mini-mesters, which is what we call them. And a mini-mester is a 7-week period of time. So you'll see when we do the curriculum plan that the student will take a set of courses in the first 7 weeks, the first mini-mester, and then they will go to the second 7 weeks and complete a separate, different selection of courses in the second mini-mester. A student cannot move to the second mini-mester without successfully completing the courses scheduled in the first mini-mester. So the daytime 4-semester program does not include summers, and it's offered at the Gettysburg, Harrisburg, and Lancaster campus. We have another 4-semester program offered at the Harrisburg campus only, and that is a weekend program. It includes summers. The students in the weekend program have class on Friday and clinical on Saturday and Sunday. We'll talk about each of these programs specifically later on in the presentation. Our 8-semester program takes the 4-semester program and stretches it out into 8 semesters. So what the students would take in 7 weeks at a 4-semester program, the students in the 8-semester program take over an entire 14 weeks. So what was in the first mini-mester of semester 1 is in the first semester of the 8th semester program. What was in the second mini-mester of semester 1 is now in the second semester of the 8th semester program. We have 2 8th semester programs. One is the daytime 8th semester program offered at York campus only. It includes summers, and it is a daytime class with weekend clinical schedule. The evening program 8th semester courses are offered at Gettysburg, Harrisburg, Lancaster, and York, and the evening program offers class and clinical during the evening. It too includes summers. Very important that we understand that if you select a curriculum that includes summer hours, vacation is not considered an excused absence. It would be not educationally sound to allow a student to miss a week of a summer session that is only 11 weeks long. So a student who is requesting to be out of clinical and class for 1 week is essentially asking to miss about 10% of that semester's instruction. And that's not educationally sound. So we expect that our students will attend all classes and all clinical, regardless of whether they're scheduled in the summer or not. How is our concept-based curriculum different? When you are taking your general education courses, your experience has been probably very much like what we're doing this evening. You come to a time where you've registered for a course, it starts at 1 o'clock. The faculty member is in front of you as a class, giving opportunity for questions and answers and presentation. But basically, the faculty member is kind of a sage on the stage or an actor in front of you. They have a captured audience and they really are the focus of attention. That is more concrete learning. And the student's experience in that is that they come to class, they engage with their class, they take notes. They go home, they review their notes. They study their notes. They come in to take a test and the test is on those notes. That's not nursing. The reason why that's not nursing is that we cannot present to you every disease that you will come in contact with as a nurse. So we have to be able to teach you commonalities. We need to be able to teach you concepts so that when you gain an illness in a patient, you can say, well, I don't remember what that is, but I know it's this. And so I'm going to think about this as my assessment. An example of that is our students in December of 2019 graduated from our curriculum having never studied coronavirus, COVID-19. They graduated, they began their careers. They came to March of 2020 and began to get patients that came into their care with a disease that they had never learned about. So we needed to have them ready to care for those patients. Those patients remember, or students remembered, what they learned about the concept of infection. They remembered what they learned about the concept of inflammation. And so they used that knowledge to understand that this was a virus. So it had a viral cycle. There were points of transmission that needed to be protected. They realized they had to wear a mask, that it was an N95 respirator mask, and they knew what that was. They realized that it was an inflammatory disease, so they would have to watch for breathing problems, and they would probably treat it to reduce the inflammation. And it gave them the foundation to be able to make critical thinking and clinical decisions about the patient's care. To do that, and this is very important, a nursing student must prepare before class. I know we're told that we have to prepare before class with every class that we've taken, right? But if we're realistic, we do and we don't with some classes. You can't do that with nursing. And here's why. Your nursing faculty are going to expect that you will have engaged with the material that is being presented in class before you walk into the classroom. Your first introduction to that day's material is before you even step foot in class, as you read the assigned readings, review the assigned videotapes or podcasts, and come into class having engaged with the material, really knowing what you understand, but knowing what you don't understand and what you have questions on. And then what we do is provide opportunity to summarize, give students opportunity to ask questions. But the bulk of that class is going to be an interactive type of learning experience that then ends with a summary of what we learned. So for example, if I am teaching high blood pressure or hypertension, you're going to be reading, what is hypertension? What are the causes of hypertension? What does the patient look like when they have hypertension? What do we do about hypertension? Okay, some of it will make sense, some of it will not, but you'll come into class having that knowledge. And I would start out with class, okay, so what did you learn? What questions do you have? And we do a very short review. And then I say, Mrs. Jones has a blood pressure of 90/60. What does that mean to you? A student will say, well, Mrs. Donnell, that's not enough information. What was her blood pressure yesterday? A student might say, well, why do you need to know that? 96/60 is low, right? She's got low blood pressure. And another student would say, yeah, but did she have medications on board? Did she just take her medications? And another student would say, what happened yesterday? And if you are a student who prepared for class, you're going, oh yeah, oh, I was going to ask that. Oh, that's a good question. And you're engaged and you're interacting with it, okay? The case study unfolds and you find out that Mrs. Jones is really a patient that had surgery yesterday and is bleeding. That's the reason for her blood pressure problem. So we're going to start an IV. We're going to call the physician. We're going to hold her blood pressure medications until the physician gets back to us. And we may be preparing to send her back to surgery this afternoon. If you're the student who prepared for class, being a part of that unfolding case study validates that you know what you're talking about and gives you self-confidence. If you're a student who did not engage with the material before you came to class, you're left feeling confused, feeling like the faculty member never teaches you, feeling like all the faculty member does is have conversations, and you're very frustrated. In addition to that, we use high fidelity simulations. So you'll be coming into the lab, working with mannequins, being able to make critical thinking decisions, see what happens to the patient's vital signs, maybe kill the patient, have us determine why we killed the patient, and then figure out how we don't do that again. Okay, so that is your nursing classes. And again, when you are making a determination which program to select, please do not fit school into life. You have to make a decision that allows you to know that you will have acceptable amount of time to prepare before you come to class, or you're setting yourself up for a very frustrating experience. And then that's class. So clinical is really exciting. Not only do you have that clinical lab that we just talked about with high fidelity simulation, but you'll have an opportunity to come into the lab, practice skills that you don't get to do a lot on clinical, so that if they come up unexpectedly, you know how to do them. But the clinical experience is really the rich part of the nursing program. And we utilize pretty much all of the hospitals within the counties of the campuses that have programs. The Lancaster campus uses a lot of York and Lebanon County facilities. Harrisburg campus does use mostly Dauphin. Gettysburg campus is in the Adams and York County area, and York uses York County facilities. We all will have a time when we go up to Penn State Hershey Medical Center's Children's Hospital, which is located in Hershey, Pennsylvania. We get asked a lot about, how has COVID affected us and nursing education? If you would have asked me in March 4th of 2020 whether I felt that we could teach nursing without being face-to-face, I would have said no, and I would have been wrong. We were forced, when we left for spring break in March of 2020, we were forced to come back from spring break in a remote setting, and we have been remote from that time until now. We're beginning to transition, and many of our courses are coming back to campus. As a matter of fact, most of the first courses that you will take in the curriculum will be on campus: Nursing 140 and Nursing 141, PN 140 and PN 141, as well as both 142 courses for the 140 for the nursing and PN. So what's class like when it's remote? Well, it's very much like we did today. You'll have an assigned time to log on to Zoom. You'll interact with your class as you see on the screen. It's kind of nice. You get to see people in their home environments. You get to meet pets and children. It's been a good experience, and we've been very successful in giving high quality education through remote. We would love to come back to face-to-face, and as soon as the pandemic allows us to do that safely, we will do that. The clinical lab, the campuses have been closed, but the clinical lab is opening for appointed times that are throughout your course schedules. Clinical has been face-to-face. We are in clinical facilities engaging with actual patients. We've been doing that since August of 2020. Our students, when they are in class, in the lab and on clinical, must always have a face mask on. And when they are in the clinical lab or on clinical, they must also, in addition to the face mask, have a face shield on, a full face shield on. It's been very effective. It's kept our students safe. It's kept our faculty safe. And students really feel like they can get a good clinical experience and feel safe, feel protected from getting coronavirus or any other kind of illness. It's not comfortable, but it's been working out well. And our NCLEX pass rates have not dropped. Our employee satisfaction has not dropped. We really feel as though it's been a good transition. Looking forward to going back to face-to-face, but it's been a good transition to remote learning. A little bit more specific about the programs now. So we talked about what a practical nursing is. Important to understand that both practical nurse and a registered nurse will be a service profession. And so as a service profession, you will be caring for patients on nights, weekends, evenings, holidays. It's not something that you always get to select your shift when you're a new graduate. So you should really go into the profession understanding that you're going to be serving patients at times when you would normally be off if you were in a regular 9-to-5 job. The median salary for a practical nurse in our area is about $47,000. It can increase depending on what additional responsibilities you take on in your role. Why choose our PN program? Well, quality matters. The NCLEX PN licensure exam that I talked to you about is the exam that a graduate must take and pass. And if they pass it, then they become a LPN or licensed practical nurse. The first attempt pass rates for HACC are the highest in the state of Pennsylvania. We have a 15-month concept-based program. It's 4 semesters, operates with a consistent schedule across all 3 campuses, Harrisburg, Lancaster, and York. Starts in the fall, and the students will go the fall semester, spring semester, summer session, and graduate at the end of the second fall semester. So the students who started in fall of 2020 will graduate in December of 2021. The class that we just started in fall of 2021 will graduate in December of 2022. The second reason is that our PN program is completely stackable into our RN or associate degree program. Students who successfully complete our LPN program and gain licensure and become an LPN may come back to the program, take 4 additional nursing courses, 4 additional general education courses, and graduate with their ASN eligible to sit for the NCLEX RN. So it allows you to take the LPN courses and you don't lose money because those courses are going to be included in your ability to get your RN. And the PN program assures that you're going to have financial aid. So here's what that PN program looks like. As I stated, it's 140, 142, and 143 in the fall semester. We talked about mini-mesters, right? So the fall semester at HACC is a 14-week semester. These students will take 140 and 143 in the first 7 weeks of that fall semester. And if they're successful in those 2 courses, in the second 7 weeks, they'll take PN 142. The spring semester, they'll go on to take PN 141 and PN 144 in the first mini and PN 145 in the second mini. Actually, the PN 140 and the 141 courses are a 14-week course. But you get the idea that the curriculum is split between 7 weeks. The specialties are in the summer. So that is OB, Peds, Mental Health, and Geriatrics. And then the final courses are in the final fall semester, PN 150, 151, and 152. So the way it would be designed is that practical nursing 40 would be over the whole 14 weeks. Students would take 143 in the first 7 weeks, 142 in the second 7 weeks. 141 would be over the whole 14 weeks, PN 144 in the first 7 weeks, PN 145 in the second 7 weeks. The summer's a little different. It's a 12-week summer session with 4 courses. And so each course is a 3-week session. So they would take PN 242 over 3 weeks, 243 over 3 weeks, 244 over 3 weeks, and 245 over 3 weeks. Then in the fall of 2020, or in the fall, the second fall, they would take PN 152 over the whole 14 weeks, 150 over the first 7 weeks, and 151 over the second 7 weeks. What is the time commitment? It's a very time-intensive curriculum. When you're coming to campus or being remote for class in the first fall semester, it'll be 1 to 2 days a week, about 3 hours of class each of those days. In spring and the fall, the second fall semester, it's 2 days a week, 3 to 6 hours each of those days. In the summer, your class is Monday and it's 8 hours from 8 to 4:30 on all of the campuses. Clinical in the fall semester has no clinical for the first fall semester. Spring and fall 2, you will have clinical Monday, Wednesday, and Friday. Summer is Tuesday, Wednesday, and Thursday. And those clinical days are anywhere from 6:45 until 4:30. It depends on which course and which campus as far as what the clinical schedule will be. So why would you consider coming to the LPN program if your ultimate goal is to be a registered nurse? The registered nursing curriculum requires you to have a T-score of 70 in order to qualify for application. Sometimes that's difficult for students. So they struggle to gain that 70 and they feel like all they're doing is taking the TEAS test over and over again. The LPN program is an option because the LPN program will allow you to qualify for admission into the LPN program with a 60 or above T-score. So students will come into the LPN program. That LPN program has increased their knowledge. So they retake the TEAS and they often score above a 70. As long as their T-score is above a 70, their GPA is a 2.5 or above, and they have passed the LPN licensure exam and are now an LPN, they will be able to come into the RN program without competing for placement. The second reason is, if you want to get into the workforce, you're in a situation where you need to be gaining an income as quickly as possible. Our students will come into the LPN program, join the workforce as an LPN, and then come back to the RN program and gain their RN, their ASN. In very many opportunities, your employer may help to pay for you to come back to school. So it allows you to get into the workforce earlier, make money while you're finishing your associate degree, and perhaps have your employer help you with tuition reimbursement. So a student who comes into the ASN RN program in that fashion will be called a STAC student. On the left-hand side, you can see all of the courses that you took in your practical nursing program that you now get automatic credit for in the RN program. On the right-hand side, you get all of the courses on the right-hand side that were part of your requirements for the PN program. They automatically come on to your transcript for the RN program, okay, for the RN program. So all you have to do is take English 102. You have to take Biology 122 and have that completed before you come into the STAC program. And you take 240, 241, 250, and 251. In that time span, you have to get your math requirement in and your humanities elective. So this is an example of a student who maybe already had Biology 122. Maybe they took that while they were in the PN program. And they come out and they get their license, they take their NCLEX PN right away, and they are now licensed as an LPN. They graduated in December of 2021. The HACC Harrisburg STAC program will allow that student to come into 240 in the second mini-mester of spring, which is about St. Patrick's Day, March 17th. They'll take 240 in the second 7 weeks of spring, 241 in the first half of the summer session, 250 in the second half of the summer session, 251 in the first half of the fall, and they can conceivably be eligible to sit for their NCLEX RN in October of fall of 22. So if a student graduates in fall of 21, they have a T-score of 70 or above, they have successfully passed the licensure exam and are now an LPN. Their GPA at HACC is 2.5. They'll come in, they'll take 240, 241, 250, 251 beginning March of 2022, and they'll graduate with an associate degree in October of 2022. Say you're not ready by March. Our Lancaster campus gives you the opportunity to begin that STAC program in the summer. So this is a student who maybe didn't have Biology 122 done. So they decided to take their boards and get Biology 122 completed in the spring, because you have to have that before you can come into the STAC program. They would start 240 in the first half of summer, 241 in the second half of summer, 250 in the first half of fall, 251 in the second half of fall. So this student who graduated in the fall or December of 2021 would have the spring of 22 to get their LPN license and finish Biology 122. They would come in the summer of 2022, and they too would be ready to sit for their NCLEX RN with an associate degree in nursing by now December of 2022. It would take them the full fall semester. And then you could also decide that you wanted to stretch it out and join one of our cohorts. You would be joining a 4-semester curriculum, and you would be taking 240, 241 in the fall, 250, 251 in the spring. So this is a student who needed a full year. They come into the fall of 2022 and they take 240 and 241. They would be graduating in May of 23. So you can see that as a PN student from HACC, regardless of whether you want to take some time to work, whether you want to take Biology 122 after you graduate with your PN certificate, there's a way for you to stack into the RN program that can match whatever your work needs are and whatever your schedule needs are. If you are in this session and you're saying, well, great, I'm an LPN, but I'm not a HACC LPN, what do I get? For our students who graduated from the old non-stacking curriculum, or for students who graduated from one of our partners in practice in the area like York County School of Technology, you too can have reduced credit load. It really doesn't increase the amount or decrease the amount of time that you're with us. We'll show you, but you do get credit for 140, 141, and 144. ATI is a resource, a textbook resource that you have to buy anyway. It's a required resource for the curriculum. We utilize that product to help you prepare for and then take a proctored examination. The fundamentals examination, if you pass it with a benchmark, will allow you to get credit for 150. And then each of the specialty courses have their own proctored exam that allow you to gain credit for those. So technically, a student who comes to us from York County School of Technology or any other practical nursing program, they have to be an LPN. They have to have completed Biology 121. But they can come in their first semester, take 142 and 143 in the first mini-mester. And if they were successful in the 150 challenge and they got credit for that course, the second mini-mester, they could take 151. And then you can see how that educational plan progresses. For 242, 243, and 244, if they gain credit for that class, they wouldn't have to take it. If they didn't gain credit for that class, there's no penalty involved. They just simply take the course with their cohort. So that's the practical nursing program. The registered nursing program, we talked about the fact that you are the coach of the team. It is too a service profession. The median salary in our area is about $73,000, and depending on how many increased responsibilities you take, whether you go beyond the bedside and get an advanced degree, you can see that it is a very profitable profession, making up to $140,000 a year if you have gotten your master's degree and go on for advanced education. So why choose our program? Well, the employers in our area will tell you that they want HACC graduates. Our graduates are the most highly sought after nurses in the state. We have multiple facilities that want to run career fairs for us and gain our students as soon as they come out of school. It is not unusual for our nursing students to have at least one position having been offered to them, sometimes multiple positions having been offered to them before they even walk across the stage to get their graduation diploma. You always want to look at what a program's pass rates are in that licensure exam that we talked about. HACC's NCLEX pass rates are 91%. So they're consistently high. The national average for most nursing programs is 86%. We also have been told that the concept-based curriculum, the concept-based program that we talked about, really prepares students to be thinkers and managers and problem solvers on the unit. Many of our graduates are nursing leaders in many of our area hospitals, and our community advisors often tell us that our students become some of the most creative thinkers and problem solvers So nursing leadership, for example, praised the HACC graduates who came to them as new graduate nurses in March of 2020 by being really, really good at thinking through COVID-19 and dealing with isolation procedures, problem solving, things that needed to be done differently, and creating really excellent infection control methods to keep both themselves, the patients, and their coworkers safe. So the 4-semester curriculum, we talked a little bit about this. The 4-semester curriculum has no summer. You'll be going fall or spring. Class is 2 to 3 days a week. Class times are going to vary by campus, but you will start no earlier than 8 a.m. for class and stay no later than 4 p.m. for class. Clinical, although we say this is a daytime program, clinical may be an evening session. You will have evening clinical from time to time in the 4-semester curriculum. Clinical is 2 days per week. The times vary by campus, but they start as early as 6:30 in the morning and could end as late as 10 p.m. This is what the 4-semester curriculum will look like. Again, our semesters are 14 weeks long, so these are broken up into 2 7-week semesters. For a student who becomes a student and enters in the fall, they would take 140, 142, and 143 in the first 7 weeks of fall semester 1, 141 and 144 in the second 7 weeks, 150 in the first 7 weeks of spring, 151 in the second 7 weeks of spring. Summer would be off. You could use that to get some of your general education out of the way. 240 and 242 in the first 7 weeks of the fall semester, second fall semester, 241 and 244 in the second 7 weeks. And then in the final spring before graduation, 243 and 250 in the first 7 weeks, 251 in the second 7 weeks. So a student beginning in fall of 2021 would be going to classes in fall of 2021, spring of 2022, summer of 2022 would be off. They'd come back in the fall of 2022 and finish in the spring of 2023, graduating in May. It's important to understand that there are some prerequisites. Students must complete 121 before they can enter the program. They must complete 122 before they register for 150. They must complete Psych 101 before they register for 244. And they must complete Biology 221 before they register for 250. Taking a look at how that would change for a student who came into the spring, you can see that this student would be coming in the spring of 2022. They would have the summer of 2022 off. They would be here for the fall of 2022, the spring of 2023, and they would graduate in December of 2023. At the end of the fall semester. So that's the 4-semester program. I'm going to skip ahead to a few slides here and show you what the 8-semester curriculum looks like. With your memories fresh about what the first mini-mester looked like in our 4-semester program, it's easy to see why this now is an 8-semester program. What the 4-semester campus did in 7 weeks, the 8-semester students will do over a full 14 weeks, and it remains that way through the entire curriculum. One issue with the 8-semester program. Why would I pick an 8-semester program? The 8-semester program is the right program for a student who's trying to balance a hefty work schedule, family schedule, school schedule. So it provides a little bit of flexibility, allowing for a slower pace of education. Instead of doing coursework over 7 weeks, you do that same coursework over 14 weeks. So that allows a student to have more time to internalize the information. It also allows the student more time to have a work-life balance if working is something that they really feel that they need to do. There's children that need to be cared for, those types of things. If you are taking your general education courses, the general education courses are mapped out in a way that still allows for that work-life school balance. If you're a student who has completed all of your general education courses, then those courses are not available to you for credit. And what I want you to understand is that the courses that are in maroon are the nursing courses. If that is all you have left to take, then there is no semester within our 8-semester curriculum where you have 6 credits of graduation required courses. So why is that important? Because if you're a student that has financial aid, you need to refer yourself to the financial aid office and have a discussion on what that means to you and the financial aid programs that you would qualify for. There are some financial aid programs that require a student to be enrolled or registered for at least 6 credits of graduation required courses. So it's important that you map out your semesters in a way where you know which semesters will have 6 credits and which semesters will not. The advice that financial aid gives to students is to think about the fact that when you do qualify for 6 credits and financial aid, to try to take out as much financial aid as you are permitted to. Keep whatever you do not spend for that semester on your refund card or on the Hire One card, and then use those funds to pay for the semesters where you may not qualify for as much financial aid. So again, I would defer questions that you have related to that to the financial aid office. Our students, many of them in the 8-semester curriculum do have financial aid, and so our financial aid office can help you in mapping that out. Coming back to the 8-semester program, we have a day program option. The only campus that offers that is my campus, the York campus. It is offered in the daytime beginning in the summer session. Class is 1 to 2 days of class per week. Those class times vary by semester. They will begin no earlier than 9 a.m. and end no later than 5 p.m. Clinical in the daytime 8-semester program at the York campus is a weekend schedule, okay? So you will take class during the week, but your clinical will be 1 to 2 days of clinical every other weekend for the entire curriculum. Clinical start times will vary by semester, but it's no earlier than 6:45, and they will end no later than 6 p.m. The evening 8-semester option is available at all of our campuses, Gettysburg, Harrisburg, York, and Lancaster. It also includes summer obligations, classes 1 to 2 evenings per week during the week, beginning no earlier than 4 p.m., ending no later than 10:30 at night. Clinical is 1 to 2 evenings per week. Clinical times vary by campus, but they start no earlier than 3 p.m. and end no later than 11:30 p.m. A word about the clinical schedules, regardless of which program you're in, 4-semester or 8-semester. It is impossible for you to know your clinical schedule more than 6 weeks before the semester starts. And the reason for that is that we must request from our clinical agencies when we would like to come to their facility. They have to grant us permission to come at those requested times. Because clinical placement is a puzzle within the county, there's many nursing programs using the same clinical facilities. It may be that a time that we requested is not available at the facility. And so the facility works with us and other nursing programs to kind of come up with a flex schedule. You can't have this day, but we can give you this day. Until we have gone through that process, we can't give you a clinical schedule because it's going to change. And the hospitals generally do not tell us when we're permitted to come until about 6 weeks before the semester starts. So you will know your clinical schedule. You'll know it before the first day of class, most likely, but you may not know it for about a month before the semester starts. So you need to be aware of that. The 4-semester curriculum has a weekend option available currently only at the Harrisburg campus. Class is 1 day a week. For fall and spring semesters, that day is Friday, and it is all day, begins at 8 o'clock, ends at 4:30. Thursdays are the day of class for the summer session, and it too is anywhere from 6 to 8 hours. Clinical is 1 to 2 weekend days a week. So your clinical in the weekend program will be on Saturdays and or Sundays, beginning no earlier than 6:30 a.m., ending no later than 10 p.m. Those clinical days are long. You can have upwards to 12-hour shifts, and you can expect that you will have both day and evening clinical rotations as you move through the program. We suggest that this option be considered only by students who have all of their general education requirements done. And this is what that curriculum looks like. These students start in the fall. Again, it is a mini master curriculum, and you can see how that works its way through fall, spring, summer, and then finishing in the second fall semester. It is important for us to really emphasize something again. If you select a curriculum that has summer session obligations, you should not expect to be able to take a week or 2 weeks of vacation while that session is in order. During the summer session, you need to be in class and clinical. So a vacation would not be an excused absence. Another thing that's important to consider is our program costs. Your major textbook is the Pearson textbook. It's on the left-hand side. We use an electronic version of that, and the cost for that textbook is included in the fees for your first clinical courses. The ATI product that I talked about, which is what we use for your proctored testing, and we use it for other things throughout the curriculum, that is also a required resource, and that is included in the tuition fees with your tuition payment. You have to go to the bookstore and buy a skills bag for the first semester and something called Nursing Central, which is a software program that you can download to your phone that has all of the things in it that you're going to need on clinical: lab book, drug book, medical dictionary, a disease breakdown, literature that you can look up for research. Buying all those at the beginning of the curriculum is expensive, right? But you don't have to purchase many textbooks for the rest of the curriculum. In addition, right at the beginning of the curriculum, you need to have your uniforms, and you need to have your stethoscope, and you need to have your watch and your bandage scissors. You also need to make sure that you do the things that you need to do to be qualified to do clinical. So that's your physical exam, your drug test, your background checks that we'll talk about in a minute. So all those things are program costs that are up at the very beginning of the program. And it's important that you understand that in that first semester, in addition to your tuition, there could be $1,500 to $2,600 of additional costs for supplies, uniforms, drug testing, physical exam, vaccinations that you might need, lab work that you might need, okay? All of that is financial aid qualified. So if you have financial aid funding, it can help you with that. But it's really important that you think about it as a family and talk to financial aid and make sure that you have that amount of money available so that it doesn't create an issue for you. You get accepted into the program, and then you get notified that this is going to be the cost of the program in that first semester. So what are your requirements for admission? The TEAS test, really, really important. And again, I showed you how to get to the information about that TEAS test on the website. It is the test that will measure your ability to read, work with mathematics, have a scientific knowledge, and use English. As an ASN, Associate Degree in Nursing, or the RN program, you need a 70 to qualify to apply. For the practical nursing program, you need a 60 to qualify to apply. Just because you get a 70 does not mean that you're automatically in the program. We'll talk about that in a minute. The T-score, a minimum score, is a 70 to qualify to apply. The minimum score for a PN applicant is a 60 to qualify to apply. A little bit about T's. T's had a version 6 that has now transitioned to a version 7. And some students have wondered, well, if I took the version 6, do I have to take it again? The version 6 will be accepted up to the application cycle for the fall of 2023. So if you are in the 2022 application cycle, you're applying for spring of 2022, summer of 2022, fall of 2022. We'll accept those versions. Once you begin to apply to come into the fall of 2023, version 7 will have to be the one that you have turned in. This just speaks a little bit about the differences between the two. So what do? You want to enter into the PN program. What do you need to do? You have to graduate from high school before the first day of class. You have to be 18 before the first day of class. You have to complete Biology 121 before the first day of class and with a C or better. You have to have a T-score of at least 60. You have to have a GPA at HACC of 2.5 or higher. If you've got that, you coming from a nursing program, you were in another nursing program, you need to make sure that we know that you're leaving that program in good standing. If you've got all that in order, then you're ready to apply. To apply, you need to meet with a nursing advisor. Please do not try to apply to the nursing program and self-advise yourself. It's really important that you have a partner to help make sure that you've done everything correctly. If you've answered yes to all those questions, then you can apply to clinical. Here's what our admission criteria is from a point standing. So you as a student will earn points. The highest component of this point is your T-score. But then the college awards you points for experience that you may have or for a degree that you may have. So say a student applies, they get a 65 on their T's. They're a nurse aide and they have a bachelor's degree in art. The 65 points that they earned on T's would be added to 4 points for their bachelor's degree because the bachelor's degree is more additional points than the nurse aide is. So we take the one that is the highest amount of points, and that student would apply to the nursing program and compete with a score of 69. So let's just say you got accepted. So what keeps you out between getting accepted and your first day of clinical? Your GPA has to stay at a 2.5 or higher. When you apply to HACC, not everybody who applies to HACC is at a college level of English and math. So you will take a placement test at HACC, and that placement test will either say, yep, you are at a college level of English, you are at a college level of math, or it will say, you need a little bit of reminder, a little bit of more information, a little bit of more math and English education. That puts you into something that we call our developmental English courses or our developmental math courses. It takes you where you're at according to your placement test and gives you coursework to make you step up in your knowledge and get you to the point of being at a college level English. That developmental English needs to be finished, and you need to be able to, you could register for English 101 if you wanted to. If you've placed in a developmental math placement, then you need to have completed that developmental math and be beyond math 80. You need to finish biology 121. And all of these courses must be at a C or better grade. If you can't answer yes to every one of those questions, you're not going to be able to come into class, and you'll forfeit your admission and need to reply. Additionally, when you gain that email that says you're accepted, there's going to be deadlines that you have to meet. We talked about the intent. That's a deadline. There's going to be other deadlines. You have to attend orientation. You have to do certain things by certain times. Really pay attention to those deadlines because they are inflexible. What are the RN requirements for admission? Well, you're going to see that they mirror very much what we just talked about. You have to graduate from high school before the start of clinicals or before day 1 of class. You have to be 18 before day 1 of class. You have to have completed the developmental English program and be able to register for 101 if you wanted to. You needed to now complete all of the developmental math and be able to enroll in Math 101 or Math 202 if you wanted to. You need to have completed Biology 121 by the first day of class with a C or better. All of them need to be at a C or better. You have to have a T-score of at least 70. Your GPA has to be 2.5 or higher. And if you're coming from another nursing program, we need documentation that you left that program in good academic and ethical standing. And you must meet with a nursing advisor. If you've answered yes to all those questions, then you qualify to apply to the RN program. And here's what that criteria looks like. Again, very similar to what the PN criterion was, with the difference that 70 is the lowest T-score that you may have. And then there are some additional items here, like if you are an LPN, you get 2 additional points for that. The list of what may keep you out is exactly the same thing as you would expect, as you saw in the PN program. Is there any way that I can get guaranteed get in? Well, yes, if you scored an 88 or higher on your T-test, and you have graduated from high school, and you are 18 years old, and you've completed all developmental math and English, and you completed Biology 121 with a C or better, and your GPA is 2.5 or higher, and you are in good standing, and you met with a nursing advisor. If all of that is done, then you will get your first choice of campuses. You have guaranteed selection, and you would have declared what your priority campus is, and that is the placement that you will be guaranteed. So now how do I prepare for clinical? Well, here we go. Spring of 2022, we've already selected that class. The next application cycle will open on January 15th. That is for the 2 programs that are at York, the 8th semester day, 8th semester evening. That is the only programs that are available in the next application cycle. That application cycle will close on March 14th. When that application cycle closes, after the selection is made, then the fall of 2022 will open April 1st. And you can see that the 4 semester programs on Gettysburg, Harrisburg, and Lancaster, the 4 semester weekend program at Harrisburg, and the 8 semester evening programs at Gettysburg and Lancaster. That application window will open. It will close on May 14th. The PN program application cycle will open up on April 1st, but I want you to understand that it will not close until June 4th. So why is that? If we have students who wanted to be selected for the fall 2022 RN program and they were not, then they would still have about 2 weeks to decide if they wanted to apply to the PN program and come in to do the stack opportunity. So that gives them the opportunity. They've got their, I'm sorry, we have no vacancy letter. And now they go to the website and they apply for the PN program. So when you do your SurveyMonkey, you will find that you will have several choices that you have to make. So here are the choices. You will get to select what your first priority, your second priority, your third priority, and your fourth priority are, okay? And they are all listed there. We talked about all of them. What we have not really talked about is what alternate means. Please pay attention to what alternate means. If you select alternate as a choice, okay, so you go in and you select Harrisburg Day alternate as your second choice. What it means is that you are not guaranteed a spot. So what you're saying is that if I am not selected for the Harrisburg campus because my point value is not high enough, I will agree to be an alternate. And I will do everything I have to do to be ready for the first day of class, knowing that I may not get in, okay? Really important that you do not select the alternate option unless there is no other campus that you want to go to. So we're going to give you some examples to help you understand why that is. This is an actual student example, okay? So what will happen is that that point value that we talked about, whether it be PN or RN, it's still the same process. So that student who had a 75 on their TEAS test and they have a bachelor's degree in an art, they'll compete with a score of 79. Students' names are taken off the list and the admissions office looks at a list of students by point values earned. The highest point value to the lowest point value in all of the applicants that have applied, okay? So when we get to that number, we will look to see if the student's first choice is available. If it is, they will get their first choice. If the first choice is not available, but the second choice is available, they'll get their second choice. If the second choice is not available, then they'll get their third choice. If the third choice is not available, then they'll get their fourth choice. If none of their first choices are available, then they'll get a letter that says that we're sorry, but none of your options are open. So you have to make sure that you select every campus that you can attend first, because here's an example. So this is a student who, when we got to their number, Harrisburg Day program had no vacancy. Harrisburg Day alternate had a vacancy. So they were dropped in as a Harrisburg Day alternate. But Harrisburg Evening also had an opening. They didn't get Harrisburg Evening because they said their second choice was to be an alternate for the day program. So the student called and said, I had a 79 on my, I'm using that as an example, I had a 79 on my point value, and I didn't get into Harrisburg Evening program. But my friend who had a 72 did. Why? It's because your second choice was available, so you got your second choice. So it's very important to understand that we do not look to see if the other things that you selected are available. We go off of what you say is your first, second, third, and fourth choice. So be very clear when you select them in the application to make your second choice that you can attend, okay? Here's another example. This student had a 75, let's just say they had a 75, okay? Their first choice was Gettysburg campus. Their second choice was Harrisburg Day. Third choice was Harrisburg Day alternate. Fourth choice was Harrisburg Evening. They had a 75 points. Let's just say this was the value. When we got to 75, all four of their choices were filled and they got a declination letter. Lancaster campus had an opening, but they didn't get that because it wasn't one of their choices. So say they had a 75, they didn't get into the program. They have a friend who got into Lancaster campus with a 72. and they want to know, why didn't I get into the Lancaster campus? I had a higher point value. It's because you never told us that that was one of the options you would accept. So please be sure to rank all campuses in the order that you would consider attending. Don't list a campus if you can't do that campus. Don't list it, okay? And understand that it is our policy that when you are accepted into a cohort and a campus, you must stay at that campus in that cohort for 1 semester. Once you've successfully completed a semester, then you may request to transfer, but that transfer is not guaranteed. It's only based on whether there's a vacancy. So really give some thoughtful consideration to the choices of campuses. You want to also, as I said before, think about whether you can make it to their clinical sites and make that decision one that you really think through before you select the campuses in the rank of order that you do. The notification, if you are applying for us at York, you'll know by March 18th, May 19th for the fall cohort of RN, and June 9th for the cohort for PN in the fall. Okay, so now you've been accepted. You told us you're coming. Now, what are you going to have to do? Well, you need to complete 3 background checks. We require a Pennsylvania state background, an FBI federal background, and a Pennsylvania child abuse history. And you'll be doing that every year while you're in the program. You must do that through a third-party vendor that we tell you, which is Castle Branch. You'll get that information in your admission letter. You must be aware that there are some criminal backgrounds that we are not permitted to allow you into the nursing program. We will not make that formal declaration to you until you are in the program and we actually see the background check from Castle Branch. But we do want you to, when you're accepted into the program, if you know you have a clinical background, a criminal background, we want you to make an appointment with the program director and make sure that you have a conversation of what that is so that you know whether you're able to be retained in the program or not with that history. If you ask us before you've admitted into the program for a decision on whether your background would create a problem for you, we can give you an idea, but we will not give you a formal answer because we need to actually see the document from Castle Branch at the time that you're in the program to make that formal declaration. You'll need to do a physical exam. The form that you use as part of the Castle Branch profile, you'll get that Castle Branch profile information to start that profile when you're admitted into the program. You are required to have immunizations. If you don't have proof of your vaccination record, you will need to make sure that your physician orders what they call titers, which are lab tests. We need to know that you have immunity to all of the various communicable diseases that you're going to come in contact with as a clinical student. This is not HACC's rule. This is a rule of the Center for Disease Control. Another important point is that flu vaccines are mandatory. That is not HACC's requirement. That is a requirement of the clinical agencies to which we contract with to have your clinical experience. Which brings us to the COVID vaccination. HACC and HACC nursing do not have a requirement for COVID vaccination. But the reality is that the clinical sites that you must go to complete the program may have a COVID vaccination requirement. We are guests in their facilities, and you cannot meet the course requirements if you cannot go to clinical. So we must follow the requirements of all of our clinical sites with regard to any immunization requirements that they have. We have been made aware to expect that the clinical agencies that we use across the college will be requiring COVID vaccinations at some point. So what we have told our students And what we are telling you as incoming students is that as of August 26, 2021, the program cannot guarantee clinical placement to students who have not received the COVID-19 vaccination. Additionally, you will need to every year do a drug and alcohol screen. While alcohol is legal, you want to make sure that your alcohol screen comes back negative when you test. The reason for that is that if it comes back positive, we need to have you repeat the test because we are not permitted to have a positive alcohol screening on file. These tests are part of the cost of the student that we talked about at the beginning, or when we talked about that first semester cost. What comes up oftentimes is if you're a student who is on a drug for a valid reason, for example, you may be on some kind of amphetamine drug because you have ADHD. What will happen is if your drug test comes back positive for that, it will not be reported to us by Castle Branch as positive. They will contact you. They will try to contact you 3 times by phone, leaving no voicemails. And the purpose of that contact is to gain from you the name and contact information for the primary care provider who prescribed the drug to you for treatment. They will contact that primary care provider, validate that you have a medical reason for that drug to be in your system. And after that interaction, they will then report your drug test as negative to the college, and we will not know that it ever tested positive. If you cannot gain that telephone call, so you missed the telephone call, they didn't leave a voicemail, then they will report your drug test as positive to the college, and the campus director will receive that notification. The campus director will reach out to you, notify you that we've gotten a positive drug test, and give you the information to connect with the medical review officer at Castle Branch. You connect with the medical review officer, give them your primary care provider information, and the validation goes from there. And they then turn that drug test from positive to negative. The only exception to that is medical marijuana. Medical marijuana is legal in the state of Pennsylvania. However, it is not legal federally. And because the hospitals and clinical agencies that we utilize for clinical accept Medicare and Medicaid funding, they are federal funding programs. So it as a federal law, they may not allow a patient caregiver to be positive for marijuana, whether they're a medical marijuana patient or not. So if your test comes back positive for marijuana, it will not allow you to remain in the nursing program, whether you have a medical marijuana permit or not. So why should you come to us? Quality. Nursing programs are judged by when you are a student in the program, how many of our students graduate? Our completion rate is 80%. Our first-time licensure exams are some of the highest in the state. Our RN program is about 91%. PN program is 98%, and that's been consistent for years. The cost, about $25,000 from the very first course that you take until graduation, and that includes all of the things that we talked about, textbooks and resources. Job placement, 99% of our graduates are employed within 6 months. Most of them are employed before they even graduate. And again, we mentioned the fact that this program is a starting point. We expect our students will want and choose to go on to BSN programs. So we have contracted and partnered with 14 different programs, more than that actually in the area. The 3 that are the most common in our region are Millersville University in Lancaster, Eastern Mennonite University also in Lancaster, and York College of Pennsylvania in York. Those 3 programs have online options, and they have very smooth articulation agreements with HACC. There are other institutions like Drexel and University of Phoenix who also have articulation agreements with HACC and actually allow students to complete some of their courses while you're at HACC. And so you can think about between 12 and 18 months after you graduate from us, you have the opportunity to now have your baccalaureate degree. There are some links for program information. And that is the end of the program. So again, if you want information on this program, what you do is to make sure that you go to the HACC website, click on the search engine and enter either RN or practical. And that will take you to a page that can review everything that we covered in the information session. If you have further questions, you're welcome to give the advisement team a reach out. Their email information is on the website. You certainly can reach out to the nursing department for questions that you might have or attend a live information session. That schedule is also on our website. Thank you for choosing HACC, and we hope that we see you soon.